Bismillahirrahmanirrahim. Assalamu alaikum. Welcome to the channel. This is the sixth video of insulin course series. In this video, I would like to talk on premixed insulin. What is premixed insulin? Premixed insulin is combination of short-acting insulin like regular insulin and intermediate-acting insulin like NPH, etc. It is used in various strains like Humulin 7030, which contains 70% intermediate and 30% short-acting insulin. Premixed insulin mimics basal bolus regimen, in which intermediate-acting insulin acts as basal dose and short-acting insulin acts as bolus dose. As mentioned in first video of this insulin course series, formula for starting premixed insulin in outpatient type 2 diabetes suggests if value of fasting blood sugar divided by HbA1c is less than 20, then it is better to start the premixed insulin. The dose for premixed insulin is calculated as multiply weight of the patient in kilogram with 0.3 or 0.5 like basal bolus regimen. Divide total calculated dose into 2/3 and 1/3. Give 2/3 of insulin units in morning before breakfast and 1/3 of insulin units in evening before dinner. If fasting plasma sugar is not in target range, such as if it is more than 130 mg per deciliter, then uptitrate the evening dose of insulin by 2 units on every third day. On the other hand, if evening pre-dinner sugar is more than 130 mg per dl, then uptitrate the morning dose by 2 units on every third day. This was all about today's video. Thanks for watching.